Welcome to another episode of Key into Quality, a Mayo Clinic podcast focusing on healthcare quality and experience trends and solutions. I'm Dr. Tim Morgenthaler, a professor of medicine at the Mayo Clinic and vice chair of Mayo Clinic Quality. Today, we're going to talk about how non-humans can improve our human experience. The topic is animal-assisted services, and we've got a great guest today to help us learn more about this. Co-hosting with me today is Sheri Nemec. Sheri?
Welcome, everyone. I'm Sheri Nemec, Consultation Relationship Manager for Quality at Mayo Clinic. Dr. Morgenthaler, I just wanted to share a quick experience that I had a couple of years ago. I volunteered for a day camp for kids who were experiencing grief and loss of someone close to them. And included in the camp were also non-human volunteers,
Ah,
two therapy dogs, and wait for it, a pony. Wow, it
wow.
was amazing. I was so amazed at how the kids and the animals bonded together, especially during those really difficult moments of grief. So it was amazing to witness, and I was just so honored to be a part of all of that.
Wow. Yeah, I'll bet many of our listeners have experienced similar things. So today, Sheri, we're talking about paws, hooves, it turns out, and maybe even feathers. I have no idea. But that's right. We're going to talk about non-human companions and how they're transforming the human experience in clinics, hospitals, hospice care, special camps all over the place. So from therapy dogs that I know can ease anxiety to apparently horses that can bring calm to patients in need. This is really more than just feel good stuff. There's a science behind it. It is a service and it has a place in compassionate care. So I'm really looking forward to our conversation today where we're going to learn about, I think, a lot more about the benefits of human animal bonds. So I've seen some studies that show that therapy animals can result in lowering of the blood pressure, reducing anxiety. I've seen them change the tone in a stressful workplace. I know when we were going live with our electronic health record here, there were little
Right.
visits from some of these dogs, and the whole room just kind of melted for a little while. So this is really cool. If you're ready to learn, let's begin. And we'll start by just introducing our guest, Whitney Romine. Whitney, you're an animal assisted services manager. That's your title, but please tell us more about yourself and welcome to our show.
Thank you so much for having me today. I'm very excited to be here, especially as a quality nerd myself. That's really a lot of what I do in animal assisted services. So, yes, I'm the animal assisted services manager at Mayo Clinic. I started as a coordinator in 2022, Thanksgiving. I moved to Rochester from Ohio for this role and then got promoted pretty quickly because, at Mayo Clinic, everything moves at the speed of light. And we've got a lot of programming that we offer to our patients. So, my background, I have a master's in public health. I chose public health because of the One Health initiative that's purported by the CDC and other public health organizations, which looks at the relationship between humans, animals, and the environment and how they all impact each other's health. So, that's the background that
Wow.
I bring into this. I'm not just a dog trainer. I look at how do we integrate this as a public health initiative. I was just on the Quality podcast yesterday that was talking about patient experience is public health. And so that's how I see what I do here. I'm also a certified animal assisted intervention specialist, meaning I have training on zoonotic disease prevention. So, looking at diseases that can be transferred between humans and animals and how we mitigate that, animal handling best practices, animal body language, making sure that we're incorporating that into our practice to provide our best service. I'm also a certified professional dog trainer, so I know how to communicate with animals and teach them new behaviors and teach them how to navigate difficult environments. And recently, I became a healthcare administration instructor at Mayo Clinic, which I never imagined in my future, but we're doing a lot of educating of providers. So it was a really beneficial jump to be able to provide that service for Mayo
Whitney,
Clinic
you are
clinicians.
just such a great example of why I love to work here at Mayo Clinic because you just meet such interesting people. I mean, what a wide array of interests. How did you first get interested in this field of animal services? Can you tell us a little bit about that?
Yes. So for me, it started in middle school. I was doing very poorly in school. All of my friend group had been separated into different, when you grow up and you go into a different school district and everybody gets kind of spread out. And I was getting feedback from my teachers that I was having a hard time engaging or that I was kind of quiet or withdrawn because I was struggling with trying to make new friends. And my parents tried everything. They tried tutoring, they tried all kinds of services. And finally, they were like, we should just get her a dog. She's been begging for a dog. And so that was Pico. He was the heart and soul of my life for 17 and a half years. So he saw me through every life transition. And so he is my passion for why I love this work and how I understand the human animal bond because he was my personal experience with it. So, because of that experience with Pico, every time I would volunteer, or every time I would take part in some kind of activity, I'd always think, this is great, but I wish I could do it with a dog.
Tell us
um,
a little bit about Pico here. Now you've introduced Pico.
Pico is a Tibetan Spaniel, which is not a common breed, but they look kind of like a Pekingese, except their snout's not quite as punched in, if you will.
Yeah.
They are kind of a snooty breed, so they're very kind of stuck up. I'll tell you what, like that dog was probably the best thing that's ever happened to me. What I really loved about him was that he knew exactly what he wanted. He was kind of like a cat in a dog's body. He loved to be outside. He loved to be out in the sun. So he's like the ultimate well-being dog, right? He does mindfulness. He does everything. But he loved me fanatically and unconditionally. So he would wait to hear the bus bringing me back home from school, and he would wait by the door. When I started driving, he even learned the sound of my truck. And like if my parents drove in their cars, he wouldn't get up and be interested. But if he heard my truck coming in, he would race to the door and look for me.
What a
He was,
blessing. Makes my heart just be warm.
I love that dog fanatically. Like I even get a little teary when I
We,
think about
we,
him.
we can still hear it.
So it started with him, and then I thought about, what else can I do with this? What else can I do with this love that I have for my dog? So I started working in healthcare and doing other things. And so I would look for like, oh, there's a heart walk going on or a walk to support diabetes and raise funds and awareness. So I would take my dog on these walks. But then I started looking for, okay, so what else can I do with this? And ultimately, I ended up being hired in a role in 2010 in hospital volunteer services because of all of my volunteer experience. They approached me and they were like, have you ever thought about being a volunteer coordinator as a career? And I was like, you pay people to work with volunteers? That's amazing. And so when I started that job, it really was like a dream that I had never even known existed. So that's why I'm always telling people when they're asking me, well, how did you get into this? I'm literally try everything because you just never know what's going to turn into something else. Like I got introduced into that hospital that I got hired at because I volunteered after Hurricane Katrina down doing rebuilding efforts during my spring breaks in college. And then when I got back, one of my professors found out about it, referred me to my local public health department, and then they invited me to a safety conference talking about disaster relief. And that's where I met the safety officer who took my resume back to the hospital that hired me as a volunteer coordinator.
Wow.
Wow.
So you just never know what's
You
going to open
don't, do
those
you?
doors, but you just try stuff. And eventually, if you follow your passions, oftentimes it will open the doors that you need. So I was one of those people when I did my undergrad, I picked a degree like this. I know everybody's like, no, don't do, but I didn't
So
know what I
I
wanted to
just have to
do.
say, because you can't see Whitney, she like closed her eyes and like pointed at just some random place on the
Oh yeah,
paper.
I had the undergraduate catalog open and I was just like flip, 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 point. And so it was community health education was the original degree I started with. And I just thought, well, it's broad enough that I can try different things with it. And so I eventually ended up in healthcare, which worked out perfectly. In my role in volunteer services, that's where I got introduced into animal assisted services for the first time ever. With volunteer coordinators, it's very common for them to have multiple caseloads, if you will. So my caseload was direct patient care service volunteer opportunities. So I supervised wheelchair transport volunteers, information desk volunteers, but then I also supervised specialty programs. So I supervised the high school volunteer program or a teen volunteer program. I did 4 different shadowing programs. I had one for GRE graduates who were looking to get to start a new career. And so we paired them up with different careers to shadow. I had one for high school students who were enrolled in healthcare classes that were interested in moving on into healthcare careers. And then I had another one that was just a generic shadowing program that was open to the community. So if anybody just wanted to learn a little bit more about healthcare, they could do that. In addition to my special programs was our pet therapy program. So I only had 10 teams. It was a very small program, but I always got in trouble because my supervisor was always saying, Whitney, you've got to love all your other programs as much as you love this one. And I was like, I can't.
Yeah, it's just
I,
not
lit-
possible.
I can do the job, but I can't love them as much as I love the animal assisted therapy program. So we had such a fabulous program and it just really got me excited about it. And so I was always looking for opportunities to do more. And a year later, after I saw the evaluation and realized that it's not as bad as I thought it was, I kind of hyped it up in my head as this being this extreme obedience trial, like you see on TV, right? Where the dogs come
Right.
on stage and they're perfectly positioned and they measure the straightness of their spines and all this other stuff. And so I thought, oh my God, my dogs do not have that level of training. But then I saw the evaluation and saw that it was not about that. It was not strictly about will the dog do everything exactly as you say. It was really about does the dog actually like people? That was most important. And then, can you communicate with the dog generally to get through life? And do they have generally good manners and politeness? And I was like, well, I do have that in a dog. So no, I did not test Pico. He did not want to be a therapy dog. He loved me and only me. No one else in the universe
Ah,
existed. But my parents had another dog, Roxy. She was a Cavalier King Charles Spaniel, and she loved everyone, and she constantly wanted attention. And so I tested her and became a therapy dog handler volunteer shortly after I started my job. So I was working as an administrator of a volunteer program that included animal assisted therapy, but then I also became a therapy dog handler. And
you had to supervise yourself.
Yeah.
well, I actually volunteered at a different hospital that I didn't work at. So no, I did not supervise myself. But man, it was a great learning opportunity. And Roxy, I would say, supervised me because she was far more experienced than I was with human beings and the public because she was just incredible. And so I loved that experience so much that a couple years later, I became a evaluator. So I got my license through the organization I was volunteering with to be able to evaluate other therapy animal handler teams. And I always tell everybody that was the best thing I've ever done for my career because you think you know dogs until you see 100 of them, and then you're like, I didn't know anything about dogs. Sample size of one versus sample size of 100, right?
Right.
So I really got to learn about what it means to be a therapy animal handler and all the different ways that therapy animal teams can be successful. And so after becoming an evaluator, I got a blind invite to a conference in Cincinnati, Ohio. I think it was the Animals for Life conference. And I talked to my supervisor, and she's like, sure, whatever, go ahead, try it out. And I went to this conference all by myself, baby administrator, not sure, I don't know anybody. And I'll never forget, I'm sitting in the audience and they introduced the keynote speaker, who is Dr. Aubrey Fine. And if you're an animal assisted services nerd, every single person listening to this will be like, Dr. Aubrey Fine. He's considered one of the keynote contributors for animal assisted services being developed as a professional practice. He's a psychologist, but he practices animal assisted therapy with his patients. So he was sharing a story, and he's literally standing right next to me telling this story. So I'm just nerding out. He's telling this story about how he works with pediatric patients who are often referred to him because their parents made them go, right? Because kids don't often want to go to therapy. Their parents tell them that they need to go because there's something wrong with them, or that's what kids will hear, is that there's something wrong with them. And so they're already feeling stressed. They're already feeling like, what's wrong with me? I don't want to be here. And then he trained his parrot to go out to the lobby and tell his patients, the doctor will see you now. And so as soon as I heard that story, I thought, "Oh my god, to be that kid, like,
Oh,
sitting there feeling
yes.
terrible about yourself, and then this parrot shows up." Suddenly, you don't think about that anymore. All you think about is, "Who is that parrot? What is his name, and how did he do that?" So, of course, if I were that kid, I would be following that parrot back to the doctor, and I would be like, "Hi, what is that parrot's name?" Right?
Right.
Totally transforms the care experience because now you have this fun, engaging way to connect with your provider. And in that moment, when I heard that story and I thought about what it'd be like to be that kid, that's when I knew I wanted to professionalize and specialize in this work. Then I was like, how do I make this my full-time job? That was my defining moment that got me interested in this work.
And then eventually you came to Mayo Clinic.
Yes, it was a very, very long road to get here because making the case for animal assisted services for a dedicated job is very difficult in the hospital because most animal assisted services are volunteer programs, if you will. Like they're all animal handler volunteers. And so most hospitals will say, well, volunteer services has it handled. Well, yes, they can collect the paperwork and they can make sure that volunteer program policies are followed. But what happens when a dog passes their therapy dog test, but then they come into the hospital and they're not quite ready? Do we just kick them out and say, sorry, come back later? But there's no opportunity for them to train in a hospital because the public isn't allowed
Right.
into hospitals. So we send them back out into the world and we say, well, go fix this and come back and try again. Or we can hire someone who can help them acclimate. And usually it doesn't take that long if the dog really wants to do it. But a lot of hospitals will say, well, we're not going to hire a dog person. We're a human healthcare organization. We treat humans. But the way I see it is these therapy animal programs are growing. And so if we insist on having therapy animal programs and seeing our patients and providing the best service, we have to have somebody who's a subject matter expert to oversee it, just like we do with any other service that we offer to our patients. We have subject matter experts that oversee medications, that oversee surgery, that oversee any form of practice that we offer. Why not therapy animals?
Right. So let's dig into that a little bit more. Can you tell us a little bit more about Animal Services Program at Mayo? How's it structured? How many sites, therapy animals, whatever you want to share is great.
Absolutely. So animal assisted services is very different at Mayo Clinic compared to other hospitals and healthcare organizations. At this point, we are the only animal assisted services department within the enterprise, but I do a lot of consulting and talking to other sites and just letting them know here's what we do here in Rochester so that they can take that information back. Or I share resources with them. Here's things you can read if you would like to update certain practices so that they can improve their own practices. In most of Mayo Clinic, the health system, Florida, Arizona, their animal assisted services are the Caring Canines program. This is your typical volunteer animal assisted support volunteer visiting program. So volunteer services handles those programs. What makes Rochester a little bit different is we have two dedicated staff, and in the animal assisted services, it's an independent unit. So I'm the manager. I am responsible for setting the policies and procedures, if you will, overseeing the entirety of how animal assisted services are implemented within practice. And I serve as a sort of support and resource for clinicians who are looking to do more. And so I develop new programs. I look at what is our current practice and what else can we do. But I also have a coordinator who supports me in the day-to-day operations. So she'll do the scheduling of special event requests or scheduling of therapy dog teams to go to different units. And she and I work closely together to implement that here at Mayo Clinic. It started in integrative medicine and health, interestingly enough, because it was considered an alternative or a complementary practice, if you will. So Mayo Clinic originally considered it like massage therapy or acupuncture. They wanted to treat it with the same clinical rigor that they would any other service that we offer to patients. But during the pandemic, they had to focus on patient care. There was just no way that they could run these kind of programs. And so, since volunteer services had experience in running other volunteer based programs, they took that over. But now we're rebuilding from that transition. And so, one thing that really jump started the implementation of specializing outside of volunteer services was the fact that employees are now starting to become therapy animal handlers. In particular, right now we have two facility dog, or well, now we're up to four facility dogs. We started with two, but looking at okay, well, volunteers are no longer the sole handler, but right now they're the biggest constituent base that we have. We needed to look at how can we expand that support beyond volunteers? How do we support clinicians who want to incorporate animal assisted interventions into their practice?
So give us an example of that. You've tantalized us with that. Sitting here talking about programs, maybe use this as an example of a clinician who wants to incorporate a therapy animal into their practice.
Yeah. So a lot of what I do is consulting with members of the practice to figure out what's the best way to support what you're looking to do. So the first thing I'll do is kind of triage what exactly do you want the dog to do or the therapy animal? Because a lot of times clinicians will come to me with this kind of idea, but they're not exactly sure what the animals are able to do, what they're trained to do. So they'll say, I have patient goal X that I want to meet and I help them get to Y. So the first thing I do is, well, what do you want the dog to do exactly? So, for example, we had somebody in radiology say, well, I want the dog to help my patients normalize the environment and get familiar with radiology machines. And so they had said, well, I eventually want to train the dog to be able to get into some kind of radiology machine. And I was like, okay, well, that's a great idea. I love that you're thinking about our patients and how we can normalize this activity. There are some animal welfare concerns that we need to be aware of. And so I talked through with them what would be the best options. So once we kind of decide what the dog's going to do, I help them figure out, okay, where's this dog coming from? So, do you want to partner with a volunteer and use what we call the diamond model? So, we have a clinician, a patient, and a dog handler and a dog. So, that's the 4 points of the diamond. So, the clinician's focus is the patient and the dog handler's focus is the dog. That's kind of the gold standard practice, if you will, of making sure that everybody's appropriately taken care of during an intervention. Or I'll ask them, are you looking to work with your own dog? So, if they are not wanting to incorporate a volunteer, if, for example, maybe there's privacy concerns. One example of that would be our child advocacy team. They are working with children who've experienced abuse or neglect. And so bringing a volunteer into that environment is not best for the patients. So
Hmm.
we looked at, okay, so your employee wants to be a dog handler. Where's this dog going to come from? So they chose the facility dog option, which is a dog that's trained by a service dog organization or an assistance dog organization, if you will, that has specialized skills that's been trained to work to a higher degree of behavior proofing, as we call it in the dog training world, essentially where you've done more repetitions and the dog's going to more reliably respond a certain way. So we looked at facility dog or personal pet. And so the clinicians were all like, well, my personal pet can't do this. So they went with the facility dog route. So I helped them figure out what are all your options? What do you want the dog to do? Where do you want the dog to come from? What's going to be the best fit? So I weigh all those factors with them. And then I help them with the actual implementation. So I give them education first of like, here's how to actually give dogs cues. Here's how to reinforce and reward the behaviors you want so you'll see them more often. And here's how to do it in a way that won't make your dog hate their job. That's a lot of what I do is consulting on animal welfare, not just from the perspective of it makes us feel good and we want to be good to animals, but also from the perspective of if you want to offer the best quality service to your patients, the dog has to love it, or else your patient will not get any benefit. And there are some studies that are starting to emerge that show this neurobiological effect that we have in the human animal bond where if the dog is not having a good time, your patient's not going to have a good time. And anybody can understand that when I say, think about a time that you saw a dog that was miserable, whether
Mm.
it was the ASPCA commercials, the Sarah McLachlan song, right? Or you just are walking down the street and you see a dog that looks miserable. Maybe they're all curled up and their tail's tucked under their belly and their ears are flat and they've just got this miserable look on their face. How do you feel on the inside when you,
Miserable.
right?
Yeah.
Yes,
And
I
so
feel so bad.
and our
So
patients see that too. So I always
Yeah.
teach them, here's how to get a
Yeah.
dog to enjoy this, and here's how to make it a fun and rewarding experience for them.
So Whitney, this is an amazing service. Are you able to just share a story of, like an implementation of a clinician that said, yeah, I want to bring a dog, we'll say a dog or a service animal into their practice. And how did that unfold and what did you see?
So we have a couple of examples of successes. I'm going to update here and say that we don't bring service animals in. They are dogs that are trained to assist a person with a disability, and our dogs do not have that legal classification. They don't have public access rights. So I work with
Good.
therapy and facility animals that work with the general public. So I always explain it like this. Service animals and emotional support animals have a one-to-one relationship, and therapy and facility animals have a one-to-many relationship. That can kind of help differentiate in a very
Okay.
That
clear
makes
way.
sense.
Very
Yeah,
good.
Mhm.
and I can't take full credit for that. The Association of Animal Assisted Interventions Professionals did a publication that explained that terminology, and I was like, that is the best way I can
Yeah.
think to describe it to somebody new to the field. So, a story regarding clinical animal assisted intervention. There was a story published by Mayo Clinic regarding a nurse that had reached out to me who had a patient that was struggling with a procedure. So, she was a nurse that was treating a patient in chemotherapy. He had nasopharynx cancer and he also had autism. So he was very sensitive to sensory input. And as we know in medical environments, there's a lot of sensory things going on that can be
Yes.
very overwhelming for our patients. And so he started off okay. He started off able to get through the initial procedures, but eventually the anxiety and the dread of the pain, of the needle pinch, of the side effects that come with chemotherapy started to accumulate to a point where he was no longer able to control his behaviors. And so he started to thrash. And unfortunately, it started to take 2 or 3 nurses to hold him down to get him through his treatments. And
Yeah.
so, this being Mayo Clinic, the nurse was like, there's got to be a better way that we can do this without forcing this on this young man. And so that's when she reached out to me. So she found out through talking to the caseworker and the care team that he had a Labrador at home. And so they talked to mom and said, because mom was coming with him, he's a young adult. I think he was in his 20s, but it was just a lot to manage that care. So he had somebody coming with him. And mom said, well, yeah, we have a Labrador at home, but we live out of state. It would be a huge burden for us to try to fly her in and for me to handle this dog and help my son. And don't you guys have a therapy dog program? Well, yeah, of course, we have the caring canines. And so I talked to the nurse and I said, oh, this is chemotherapy. So are there any risks that we need to be aware of in relationship to the dog? Any medication issues? And she said, no, we wouldn't have the dog while we're administering the medication. We would make sure that he's not having access, the dog would not be exposed to the medication itself, but we would be helping the patient before and after the procedure to make sure that they're comfortable. So the patient had a yellow lab at home, and we happen to have a yellow lab in our program.
Wow.
One of our most famous labs, Lily, and her handler Charlie. So I called them and I said, "Hey, I've got a case here that where I would like your help. Are you okay with this?" And so I explained what I knew, but as we always find out, there's more information that comes out as the case progresses, but luckily our team kept the lines of communication going. And so as Charlie found out new information as he navigated supporting this patient, he was able to adapt because of the training that he's been given. So he arrived at the patient's appointment. He met them, got to do a meet and greet in the beginning. And one thing that I really appreciate about our handlers is that they're really good at setting boundaries. So a lot of people think that our therapy dogs are just really highly trained and they love everything that happens to them. And that's just not true. They are individuals just like any of us. An ER nurse is not okay with being screamed at or thrashed at as much as a dog would not be okay with being screamed at or thrashed at, despite their high levels of training. So our handlers set boundaries and say, if you feel like you need to kick or thrash, then I need to take my dog out of the room because that can scare her. And that's okay if you need to do that, if that helps you feel better. But I need to set this boundary to keep my dog safe. And that patient wanted so much for that dog to feel safe that he said, "No, it's okay. I've got this." And he didn't. He didn't kick or thrash. He was able to control his behaviors because he felt calm enough with the presence of the dog to be able to do that. And so what I really loved about the story was following up on the subsequent weeks of his treatment. They went from 4 nurses holding him down to 2 nurses to 1 nurse and no restraints
Wow.
because he
Wow.
was able to calm himself through the presence of the dog and that
Yeah.
handler setting those boundaries and making sure to advocate for her well-being. And so he completed his treatment because of that partnership and because all of us worked together to meet the needs of that patient.
Oh,
Wow.
what an amazing story. I love that.
So that's part of what I do is I evaluate those
Yes.
dogs to make sure they're comfortable. Like I knew Lily. Lily's a veteran in our program. She's been with us for at least 6 years, I think. And so she is comfortable in healthcare and hospitals. She's comfortable with different levels of patient emotions and behavior. I would never stick a brand new volunteer team. I would never call them and be like, "Hey, can you do this?" Because that would be overwhelming
Right.
for them. They don't have the experience yet. But I chose a veteran team that I know has experience working with this population, that is comfortable setting those boundaries and advocating for their dog throughout the treatment. And that staff was incredible. They communicated with me and the volunteer every step of the way. This worked, this didn't work. And we all worked together to come up with that plan.
That's amazing. Whitney, you have such a wealth of knowledge in this area and the advancements that you've made in these programs at Mayo Clinic. We're just so fortunate to have you. I'm sure there are staff from organizations listening to this and saying, I want to do this. I want to start something. I want to see how can we get going in this for our hospital organization. What would you say to that person about very first steps to get started?
I actually get this call quite a bit. And so there's a lot of healthcare organizations that are interested in animal assisted interventions. And right now, the challenge is that there's not enough research and quality data regarding how to do this successfully. A lot of it is based on plausibility, what could happen. And that's an area of opportunity for
Mhm.
researchers. So that's the exciting part about it. So, in starting a program, I always tell people do your research. There are tons of resources available now that were not available, 20, 30 years ago when this was all taking off. So there's now the Animal Assisted Services International, which is a consortium of providers who have gotten together to develop standards of practice based on research, based on their multidisciplinary practices. So there are doctors, nurses, physical and occupational therapists, all coming together that incorporate animals into their practice and have come up with guidelines that can help people get started. There's now the Association of Animal Assisted Interventions Professionals, which is think of like the Association of Child Life Professionals or any other
Sure.
professional practice, the American Academy of Physicians, things like that. So there's now a professional practice guidance for professionals who incorporate animals into their work. So start with those resources to get information. What's really common in hospitals, if you're just writing policies and procedures and starting a program, is the Society for Healthcare Epidemiology and Association guidance. So that's what we know as the SHEA guidance. They have an animals in healthcare facilities document that literally lays out everything you need to know about service animals, animal assisted interventions, facility animals, and they have guidance about how often they should be bathed, what their vaccination status should be, how to keep patients safe during interactions, how often you should hand hygiene in relation to therapy animal visits. So they lay it all out, which is a really helpful document. And then the most common advice I give is start with one, start with your first yes. A lot of administrators get discouraged when they're like, but they're only letting me bring in one dog 1 day a week. Then take it. Because
Mhm.
oftentimes you start with that one dog and people see that it's not as bad as they kind of imagined in their head. So in new organizations, when you're talking to quality and legal and risk people, they're imagining the worst possible outcome because that is their job is to protect our patients from harm.
Mm.
And so they need to see how it actually works in real life to see that, okay, there's ways that we can mitigate these risks. Yes, there are risks present, but we're not bringing in random stray dogs from a shelter. We are bringing in people's personal pets who are probably healthier than the people themselves, who are getting vaccinated, who are getting bathed, who are getting doing hand hygiene. And as long as we implement all of those things, which is standard practice across the industry, it can be done safely and we can reap the benefits
Mhm.
of that.
Mhm.
So when they see that first yes, when they see that one success case, then they're often like, okay, why don't we go to 2 days a week? Why don't we go to 5 days a week? We can open this up to more units, but they need to see it done successfully and make sure there's some kind of champion or owner that can oversee and make sure those things are done appropriately. Usually, when programs start to slip, is because they haven't identified someone like an animal assisted services department or a volunteer services department, somebody who's making sure that all of those steps are being done, that paperwork is being tracked, whatever you need to be successful.
Well, Whitney, you have opened up the lid. I mean, this was really
Amazing.
fascinating and amazing.
Yeah.
so much going on there, and all we see are the fuzzy little cute things that make us feel good, but there's so much behind the program. And thank you so much for your generosity in sharing your story and your time with us and our listeners. We have come to the end of our podcast. We're really glad that you could join us, and we're glad our listeners could join us. And we're sure that the information they just heard is going to be helpful, valuable, and hopeful. It's a fun topic. So thanks again. Again, this is Mayo Clinic's Key into Quality podcast. We aim to highlight some of the first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, we'd be grateful if you left us a review on Apple Podcasts, Spotify, whatever app it is that you listen to your podcasts on. You can also follow us on your favorite podcast platform. Let others in your organization know about the podcast so that they can learn too. Until next time, goodbye.